5 things that I've had trouble getting across to disability patients. That's what this video is about, and it was prompted by 2 comments that I read one after the other recently. One comment said that everybody gets a disability exam, what Social Security calls a consultative examination, and the other person said that nobody needs a consultative examination because the answers are always in their medical records. And both of them were wrong, and I've talked about this before, but it looks like I need to re-emphasize these 5 points. Hello, I'm John Foster. I'm a medical doctor who does Social Security disability exams, and as usual, everything I say reflects my own opinions based on my own experience and study, and not the opinions of the Social Security Administration or any other medical body. Now, first off, many people are not scheduled by Social Security for a consultative examination, and that's usually because their medical records clearly show that they're disabled or clearly show that they're not disabled. Here are the common reasons Social Security will schedule somebody for an exam. Number 1, inadequate records. The medical records don't contain the information Social Security needs. And you need to understand that just because you go to the doctor frequently doesn't mean that your medical records have what Social Security needs to determine if you're disabled. Always remember, the focus of a normal doctor's visit is to figure out your diagnosis, what's causing your problems, and your treatment. How can your problems be alleviated? Your work-related limitations are rarely mentioned in your doctor's notes. I get notes on the people that I examine, and sometimes it's obvious from the notes that they're disabled. For example, an admitting doctor will have admitted the person to the hospital for a stroke, and they're paralyzed on one side of their body. And Social Security says that if you have severe loss of use of 2 limbs, whether that's 2 legs or 2 arms or 1 leg and 1 arm, you're disabled. So if you're paralyzed in 1 arm and 1 leg, you're disabled. But the most common problem that I see for disability, problems with the spine, with the neck and the back, I very rarely see information on work-related limitations. As an example, Social Security wants to know how far someone with back pain can bend forward, bend backwards, bend to the right, and bend to the left. And I've never, ever seen that documented in doctors' records. The second thing is out-of-date records. Social Security likes doctors' records that are within the past 2 years. And I talked in a recent video about a man who was up for a continuing disability review and hadn't seen a doctor for several years for the simple reason that he'd tried everything modern medicine had to offer and nothing helped with his condition. But unfortunately, Social Security made him go to a lot of trouble and expense so that I could examine him and document that his condition continued. The final one is conflicting records, and this is fairly rare, but I've seen it. One doctor will say one thing, and another doctor will say something that is completely different from what the first doctor said. And what's a poor Social Security employee to make of that? They send those folks for a consultative examination. Now, issue number 2 that I've been unable to get across is that disability is rarely approved based on your diagnosis. I've done a video on the rare cases where it is approved based on the diagnosis, but I continue to get comments saying, I have condition X, can I get disability? In the vast majority of cases, disability is approved or denied based on how your condition limits your work-related abilities. And to go through those again, they are the ability to see, hear, sit, stand, walk, lift, carry, handle objects, speak, travel, understand, remember, concentrate, persist, interact socially, and adapt. And note that some of them are physical abilities and some of them are mental abilities. Now, the most common condition that I see that is approved based on the diagnosis alone is deafness. And by that, I mean the person is deaf as a post. I can holler at them and they can't hear or understand what I'm saying at all. Hard of hearing rarely gets approved. But in the vast majority of cases, the diagnosis alone is not sufficient. As an example, heart failure sounds pretty serious to most lay people. It usually means that the heart muscle is weak, although there are other causes. But I've seen people with heart failure, everything from only the most minor limitations, like for example, they couldn't run a mile, to the most severe heart failure, where when I was working in the emergency department, somebody came in desperate circumstances and within an hour or two died, despite everything that we could do for them. And I've seen everything in between. And you can get approved if your heart failure is severe enough. But the diagnosis of heart failure alone will not get you approved. And that's the same for many common conditions, such as arthritis, for example, or spinal problems. The third misconception that I see over and over again is that disability will be approved because you have pain, and that pain is severe. I recently did a video on disability and pain, and if that's your problem, you might want to review it. Social Security's position is that they will not approve disability based on pain alone, no matter how severe you say that pain is. The pain must interfere with your ability to work. As an example, someone with low back pain won't be approved because they simply say, I have severe low back pain. But if they indicate that that pain prevents them from doing heavy lifting or carrying or bending, etc., they may be approved. The fourth thing that I haven't been able to get across is that disability is not approved based on your imaging studies. And by imaging, Social Security means X-rays, ultrasounds, CT scans, nuclear medicine scans, and most importantly, MRIs. And every time I discuss this, I get people in the comments saying that I have no clue what I'm talking about, and that an MRI tells everything that a doctor needs to know about a person and their disabilities. And no matter how much I talk about this, I don't seem to be able to get the message across. So I'm going to read directly from Social Security's website. So, in Social Security's own words, imaging refers to medical imaging techniques such as X-ray, computed tomography, also called CT, magnetic resonance imaging, known as MRI, and radionuclide scanning. Imaging and other diagnostic tests can provide evidence of physical abnormalities. However, these abnormalities may correlate poorly with your symptoms, including pain, or with your musculoskeletal functioning. Accordingly, we will not use findings on imaging or other diagnostic tests as a substitute for findings on physical examination on your ability to function, nor can we infer severity or functional limitations based solely on such tests. To put it in plain language, Social Security will not approve or deny disability based on your MRI. The final and fifth thing that I haven't been able to get across is that exaggerating or pretending on your exam doesn't help you get approved for disability. In fact, it makes you lose credibility. And once you've lost credibility, it's very hard to get it back. Medical disabilities are extremely hard to simulate for several reasons. The first is, in my case, I've been examining patients for 50 years. I've probably seen hundreds, if not thousands, of people with the condition you're pretending to have or to exaggerate. Second, people who are pretending don't know the real manifestations of the condition they're pretending to have. They imagine what it would be like to have the condition. And often the real manifestations are counterintuitive. They're the opposite of what you would imagine how someone would act with a particular illness or injury. Number 3, manifestations of some illnesses and injuries are impossible to simulate. I always get a little chuckle when I'm watching a movie and an actor is pretending to have pneumonia, because people with healthy lungs cannot simulate the sound of the cough of a person with pneumonia. Once you've seen several hundred people with pneumonia, it's obvious what's a pretend cough and what's a cough where there is pus in the lungs. And then finally, it's difficult to maintain a facade. It's really hard to keep up an act for 30, 45, or 60 minutes. As an example, I recently saw a person who was artificially short of breath. And when we were concentrating on the breathing problem, they managed to simulate being short of breath. However, when their attention was distracted by a question that I asked or by something I asked them to do on exam, they breathed normally. And then when the focus was back to their breathing, they acted short of breath. Again, I've probably seen 1,000 people with shortness of breath for all different reasons. And people who are really short of breath don't go from normal breathing to abnormal breathing to normal breathing to abnormal breathing. The same day that I saw a person simulating shortness of breath, I saw an asthma patient who was having an asthma attack. And I could tell that they were short of breath from the moment they walked in the room, and they remained the same level of short of breath throughout the history and medical exam. So as I always say, don't exaggerate your condition, don't minimize your condition either. Just tell the truth, give it to the doctor straight, give it to Social Security straight, and you'll have the best chance of your disability application being approved. Well, I hope that's been helpful. Please comment or suggest topics for further videos if you like. And as always, remember, if it happens, it's possible.